So, hello everyone. So, I'm back with part 3 of cancer. And in this part, we will look at the common signs and symptoms seen in cancer patients, which help in early detection and timely treatment. So, let us get started. So, coming to the symptoms, some of the common signs and symptoms of cancer include pain, usually due to tumor pressing on the nerves or surrounding tissues, malnutrition, weakness, fatigue occur because cancer cells use a lot of body nutrients and energy, leaving very little for normal function. Certain cancers, especially those involving bone, can lead to bone fracture even with minimal injury, and in some cases, patient may develop stroke-like symptoms due to change in blood clotting or pressure on major nerves and vessels. These symptoms can vary with the type and stage of cancer, but they help us recognize when something is wrong. And in the text box, you can see the theoretical definition of stroke, which is sometimes called as a brain attack or occur when something blocks blood supply to part of the brain or when the blood vessels in the brain burst. In either case, part of the brain become damaged or die. A stroke can cause lasting brain damage, long-term disability, or sometimes death. Malignant disease can show up in many different ways. Most patients experience general symptoms like fever, loss of appetite, fatigue, or just persistent feeling of malaise. Along with these, specific cancer produce their own specific symptoms depending upon where the tumor is growing and how it affects the particular organ. So let's quickly look at some common symptoms seen in different cancer. So let us have a look towards oral cancer. Oral cancer may begin with non-healing ulcer, white or red patches, difficulty in swallowing, or thickening of the tongue, often seen in tobacco users. Lungs and throat cancer can usually show a persistent cough, chest pain, repeated infection, or trouble swallowing. In breast cancer, a lump is most common sign along with changes in breast shape or color, nipple discharge or dimpled skin surface. Cervical and uterine cancer may present with unusual vaginal bleeding, pelvic pain or foul smelling discharge. Kidney cancer can cause blood in urine, frequent fevers, tiredness, weight loss, loss of appetite, anemia or high blood pressure. Stomach cancer often shows early fullness, indigestion, abdominal pain, bloating after meals, diarrhea, vomiting, or occasionally blood in vomit. These symptoms are not exclusive to cancer, but the early recognition can support timely diagnosis. Some early warning signs of cancer are important to remember. A change in bowel or bladder habit, delayed wound healing, or unusual bleeding or discharge should never be ignored. A thickening or a lump in a breast or any other body part is another key warning sign. Persistent indigestion or difficulty swallowing, any noticeable change in the wart or mole, and nagging cough or hoarseness can also indicate something serious. These symptoms don't mean cancer, but they do need proper medical evaluation. In many cancer, the body shows general systemic reaction. Patients often develop anorexia, which is nothing but reduced desire to eat. There is also hypermetabolic state where the body burns or utilizes more energy faster than normal. Because of this, the person enters a negative nitrogen balance, leading to muscle wasting and gradual weight loss. These changes happen because neoplastic cells, that is, abnormally growing cells, divert nutrients for their own rapid growth. In many cancer, patient glucose metabolism get disturbed. Their body cannot use carbohydrate efficiently, so it starts breaking down its own muscle protein to make glucose. This happens because of the rate of gluconeogenesis, that means synthesis of new glucose molecules increases, which further reduces the protein available for normal function. In some cases, hypoglycemic drugs may have given to help to correct the metabolic imbalance. Let us discuss anorexia or lack of hunger or reduced desire to eat, as we have discussed earlier. So, anorexia is very common in cancer patient and is often linked with depression. Because of this, their nutrient intake becomes very limited exactly at the time when the body's metabolic rate and nutrient needs are higher. This imbalance leads to negative nitrogen balance, causing muscle loss, weight loss, overall malnutrition. Over time, this can progress to what we call cancer cachexia, a severe wasting condition. Loss of appetite may be due to cancer itself, and it can worsen with fatigue, pain, fear, and emotional distress. So here you are seeing that we have a simple flow chart showing how cancer and its treatment can affect appetite and food intake. At the top, you can see how several factors, endocrine changes, secondary infection, tumor itself, psychological stress, medications, nutritional deficiency, neurological influences, and anorexia. All these directly reduce appetite. Once appetite drops, the next thing affected is food intake. But the food intake is also influenced by other issues. For example, patient may avoid food because of side effects of the therapy like nausea or mouth sores. On the other hand, social, cultural, and socio-economic factors also play a crucial role, especially in Indian context where food choices, affordability, family habit can strongly influence diet. Finally, physical factors such as pain, fatigue, swallowing difficulty, or digestive discomfort further reduce how much a patient is able to eat. So overall, this diagram shows that poor food intake in cancer patient is not only because of a single reason. It is a combination of medical, psychological, social, and physical influences working together. So we are looking at other abnormalities seen in advanced cancer, mainly related to fluid and electrolyte balance. Cancer patients often develop fluid and electrolyte imbalances, especially in late stages. One important issue in hypercalcemia, which is commonly seen in cancer that spread to the bone, such as breast, lung, or pancreatic cancer, or in tumors that produce parathyroid hormone like peptides. Severe disturbances can also occur when patient experiences repeated vomiting or diarrhea, either due to disease or due to treatment. Apart from these metabolic changes, the physical presence of the tumor itself can interfere with normal functioning of the affected organ, further disrupting the body's fluid and electrolyte regulation. So, changes in taste and appetite are also some of the very common symptoms in cancer patients. They may happen due to physiological factors like fear or pain, and also due to side effects of medications. Chemotherapy and sometimes radiation therapy can cause taste blindness, where patients are unable to clearly sense basic tastes like sweet, salty, sour, or bitter. Because of this, many develop food aversions, especially towards protein rich food. That's all for today's video. Stay tuned for upcoming videos on nutritional management of cancer. Thank you very much.